Hi, this is Nursing Camp, and I'm going to be talking to you about conceptual camp and the concepts behind the concept assignment and the conceptual blocks of the practical exam. So let's get into it, and here we go. All right, so 6 concepts. So in nursing school, we're going to be covering these 6 concepts that are the most important, and is going to go through most of the concepts or conditions that you're going to see throughout your nursing career. These are the foundational conditions that you're responsible to know moving through the nursing school and your practice. So these consist of CAD, which is coronary artery disease, HTN, which is hypertension, CHF, which is congestive heart failure, COPD, which is chronic obstructive pulmonary disease, diabetes, and then chronic kidney disease, which is CKD. These are the abbreviations that you'll see in your practice, so it's important to memorize them. This is based on these primary conditions, like I said, that you'll see that will also complicate by comorbidities. And comorbidities are further problems when 2 of these are together. If a person is diabetic and they have CAD, they're going to have more issues going on that are going to lead towards admission. Like I said, these are the foundational elements, and we're going to talk about concept mapping. Now, the important part of learning is Bloom's taxonomy, and we're talking about these lower levels. And these lower levels are recall and comprehension. So at this stage, you're just going to be memorizing the content and trying to apply it to what you're learning, because that's going to make into the next step, which is understanding. So in order to do this assignment, you have to basically do the work, to look up what coronary artery disease is and to do the research on these conditions. All the elements are here. It is your job to put them together. Once you're able to do that, then you can apply the nursing process to this and then actually start to analyze when you go to your higher levels of med search. So the first thing you're going to get is you're going to get these sheets. And then these sheets are basically going to be on paper, and you're going to cut them into different sections. And you'll see the lines on it. It's going to show them there. And at that stage, you're going to take the primary condition, which is hypertension, and then you're going to build your concept map. And this concept map is an organized method in order to look at this condition and what the different aspects are with nursing assessment, and also interventions that you'll be doing. And recognizing these cues, because it's important to recognize these cues and be verbatim on these concepts, because you're able to then apply and analyze in the higher med search classes. So the first phase of this, and the first thing that you have to do, is memorize. So we talked about earlier, we said the Bloom's taxonomy has recall. Recall, then comprehension. So recall is a memorization concept. So think of A and B. You need to know where the bones are, where the organs are, and that's recall. So the first step of recall is a mnemonic word phrase. And this is the first step of this process, to memorize this phrase. And what it is that curious dogs rarely panic, since calm assessments solely reveal complications, data, then meds, and interventions. So, educate and notify the provider. So that's your first step. Your first step is to memorize that phrase. And why do we need to know that? Because each one of these mnemonic words are related to the mapping of the concept map. So, for example, curious equals the condition. Dogs, the D is for definition. So you would have the concept, which is the condition, and then the next step would be the definition. And then the next step would be the risk factors, then the pathophysiology, clinical manifestations, subjective, objective labs, complications, and so on. And so that's kind of how you do it. So you can, and you're practicing on doing this on your own, you can have this out so that you're able to then know the order that you're going to do it in. Remember, there's only 6 conditions to learn. They're the most common conditions that you'll see in your practice. And it starts at the very beginning of nursing. Because at the beginning stages, you learned about the A&P and the physiology. But at this stage, we're looking at the pathophysiology. In order to understand pathophysiology, we need to understand these concepts. So we're going to walk through them all and as part of your assignment. So the first thing is curious condition. So that is, what is the problem? And, and like I said, hypertension is a problem. Hypertension causes complications. CAD is a problem. And these are the conditions that will most likely result in admission in the hospital. CHF, congestive heart failure, and chronic obstructive pulmonary disease, diabetes, and chronic kidney disease. There are other conditions, but these are the primary ones that you're responsible to know on this first step. So that would be the first block that you end up putting down. And you could put down, you do one at a time, and that's the first block you're going to do. And then the next step is D, dogs for definition. What does this condition mean in plain terms? Why do we need to know that? Well, it's very important to understand a definition of a concept, whether it's hypertension or diabetes. And why do we need to know the definition? Because nurses teach patients, and to explain it in layman's terms, not so complicated, but to kind of basically give an idea of what it means when a patient has this condition. It's also the nurse's responsibility to understand this condition. Next step is risk factors. Why did this patient get this condition? Well, there's modifiable, right, which means think we're in control of, like smoking cigarettes, drinking, exercise. These are all things that, a person can modify. They can modify their lifestyle. Each one of these conditions, whether it's hypertension or diabetes or CAD, they all have modifiable things that a patient can be taught of what they need to do, whether it's diet or, restrictions or, anything that they can make changes on. Non-modifiable things are things that we cannot, like genetics or sex or, race, those type of things. Can't change that. It's what you are. So therefore, that's non-modifiable. And you'll find through your nursing, program that, a lot of the things that patients have, some patients who are African American have more likelihood of having certain conditions, and Asian Americans, vice versa, Caucasians, and Hispanics. We all have our different conditions that we kind of have complications with. And you'll learn more about that in your nursing program. All right, so the next step is P, panic, and this is pathophysiology. What is happening internally? It's the cause and effect. So in A&P, anatomy and physiology, you learn the basic normals, the normals of the patient. But in nursing school, we're going to actually learn the pathophysiology. It's what happens when, these comorbidities and these problems, these non-modifiable or modifiable situations increase this risk factors. And so once we see these risk factors happening, then we have the pathophysiology, the actual problems that's going on in the body. And in your book, you're going to see in nursing, in the very beginning, the fundamentals is this is your pathophysiology. This is your physiological normal response of when you have a heart rate, or the blood pressure, or the temperature. And this is why vital signs are most important. Vital signs are most important because these are the cues. Cues are things that you can recognize that are showing that there is a problem going on with the patient, which requires either assessment or implementation. But understanding this is also very important because you are going to want to teach that patient on what it means, like why do they have hypertension, why do they have a temperature, and understanding this physiological principles allows us to then further apply. Remember Bloom's taxonomy: recall, comprehension, apply, application, apply. What might be the proper action for this or proper nursing intervention. Next page is since calm. So curious dogs really panic since calm, calm for clinical manifestations. What condition causes the overall? How does it present itself when they show up in the ER or they show up on the floor in the hospital? How is this condition presenting itself? What does it look like? This is the clinical manifestations. And it's kind of how we hypothesize our cues, right? So we hypothesize that this is the ultimate problem that is going to happen, and these are the interventions or these goals that we're going to set for the patients. And it's based on these cues or these assessments, which is the next portion. So since calm assessments are SOL, S-O-L, right? S-O-L, subjective, objective, and L, labs, and diagnostics, actually. And these are all cues. These are assessment cues, what the nurse sees first at the bedside. And subjective cues and objective lab and diagnostic. So we recognize these cues that, like I was just talking about, these might be vital signs, pain, confusion, new bleeding, shortness of breath, and depending on what the condition is, whether it's CAD or CHF or CKD, they're all going to present a little bit different. And it's very important to recognize what cues are telling you what's going on. So you identify it as unexpected. This is not the baseline. This is a new deterioration. That's how we analyze the cues. Next step is to reveal, the assessment cues is what the nurse first sees at the bedside. We're going to break it down. So subjective cues is what the patient tells you. So reported symptoms, reported feelings, perceptions, they can't be measured. They require further validation. So when a patient states something, what the nurse does is, just because they state there is a problem, what's going on with them, we validate what they're stating. And what we do is through our validations is our assessment. So we always assess the patient first. And that's called assess over implementation. So we always assess the patient first. All right, so if a patient's stating they're short of breath, what are we going to do? We'll assess their lung sounds. Or if they're pain, we're going to look at their heart rate. We're going to see where's that pain coming from. Well, if they feel dizzy when they stand up, we might assess their blood pressure. So it's important to know these subjective cues because it's going to identify each one of these type of conditions that we have. The next one is the objective cues. It's what you see, what you observe, what the nurse first sees at the bedside. So what they see, what they measure, what they find, observable, measurable data. They can be verified by the nurse or diagnostics. It could be blood pressure because the assessment is to do the assessment, and then the findings observed, you observe the blood pressure. So if the blood pressure was 88 on 52, that would be low. And there would be a complication from that. And then the oxygenation is 89%, which would also be low, or the glucose level, which is 320, which is high, and so wheezes on auscultations is also observable, objective data, objective cues. And what does that mean? That means that you have the subjective that they're going to state something, like, oh, I'm short of breath, and then the nurse assesses lung sounds, and they find out that they have crackles in their, or they have wheezes, or there's something abnormal in their lung sounds. Or they're going to check their pulse oximetry, which checks the oxygen in the blood. And they find out, wow, this person has an 89% oxygen. And oxygen level in a normal person is anywhere from 96 to 100. The next thing we go into is reveal complications. So curious dogs really panic since calm assessments solely reveal complications. And what are complications? Well, exactly like the word states, is what happens or worsens if it is left untreated. And this usually ends up in an acute principle, an acute complication. And then we'll talk more about that as we start to get into it. Complications could be, anything like a myocardial infarction or respiratory failure or a stroke or, all these complications, DKA. These were all complications that if the nurse didn't assess, these complications would then present themselves. And so it's very important for the nurse to assess and then to implement interventions and to figure out what's going on with the patient. The next thing is curious dogs really panic since calm assessments solely reveal complications, data, diagnostic, and monitor. How do we confirm trend or watch for deterioration? And that might be as simple as heart rate, where you see the heart rate was, normal heart rate 60 to 100. But then later on, you see the heart rate was 60. Now it's, 90, then it's 100. Right? So that's called a trend. And we trend vital signs. We look at what was it before. And it's very important to look at that assessment because it's going to show you, is the patient deteriorating or not? The next step is curious dogs really panic since calm assessments solely reveal complications, data, then meds. So medications, this is a nursing focus. What treats the pathophysiology or the symptoms? Like if they're short of breath, what's going to treat that? Is certain medications going to treat that? And then we talk about, this process of looking at medications, which we'll talk about in another lecture, where we actually look at that medication and break it down into these different areas. A is acute or chronic. W means how does it work? H means when do you hold it? A is assessment, which we've been talking about, assessment. And then L is labs. And then E, does it affect eating? Is it special diets? And then what stands out about this medication? And you'll learn this stuff as you start to progress in your nursing career. And you should be able to be verbatim about your medications and being able to do an AWALES 3 on a medication. Okay, next thing is nursing intervention. So curious dogs really panic since calm assessments solely reveal complications, data, then meds, and interventions. Interventions is what does the nurse do to improve the outcome? That could be as simple as sitting a patient up. If they were sitting down and they're laying down like that, and that's called the supine position. Supine means laying down. Supine, think of supper plate. Okay? So if a patient is short of breath and they're laying down like this, we might sit them up. And this is called the high Fowler's position when we sit a patient up. Now, these are all terms that you're going to learn in your nursing program, and this is kind of what we're doing as we're moving through it. But by sitting this patient up that was laying down, they may start to breathe better if they had shortness of breath. And this is why we do these interventions. And these interventions, there's a lot of them. So in your nursing program, you kind of move through all these kind of conditions, and then you learn the interventions you do for each one, so you're doing the proper interventions, because sometimes you don't set a patient up, and you'll learn that as we move through it. All right, so the next thing is educate. Well, nurses educate, and what the patient and family must understand about this condition. It's what they need to know before they get discharged. Like it's what they need to know to prevent a future, admission to the hospital. And so when we're looking at this phrase, we're looking at education as being the what is considered the most preventative in the reoccurrence of an admission. And it's very important to teach these patients these things, because if they just come into the hospital and they keep on coming back, well, they're missing some part of why do they keep on coming back? And sometimes it's just because they lack the education. If they have something like CHF, and they're on a salt restricted diet, but they're eating out or having a lot of fast food, which has a lot of salt in it, or canned goods and different things like that, and they keep on coming in, and you ask them, hey, assessment, what have you been eating? What's been going on? Are you taking your medications? What have you been eating? They've been like, I've been eating out a lot and everything like that. And that salt might cause that increased shortness of breath for the patient. All right, the next thing is notify the provider. Now, this is the most important thing: is these are cues that sometimes it's beyond your control, and so that's an important part, and that's one of the most, as we move up this Bloom's taxonomy. You have recall, comprehension, um, application, but sometimes analysis, which is higher up here. As you progress up this ladder, this analysis might be like, wow, this is a bigger issue than what I'm able to do right here. The patient is, having signs and symptoms of a stroke, like their face is drooping, or they're slurring their speech, or they're dizzy, those type of things. You're like, there's nothing I'm going to do other than, assess what's going on, but I am going to call the doctor. I'm going to notify the doctor, because this patient needs further services. They need more resources than I'm able to provide. It's very important in nursing to understand when a patient needs further resources, or whether it's in the nursing action to do what you need to do for that patient right now. All right, so the mnemonic phrase is: curious dogs rarely panic, since calm assessments solely reveal complications, data, then meds, and interventions. So, educate and notify the provider. So, the objectives of this assignment is basically to cut up your papers and to start working on it. Starting off with this mnemonic phrase. First thing is to memorize that. Once you memorize that, then you're able to put your papers in the correct order. But you have to figure out, like, which one is CAD, which one is hypertension, because each one will have its own definition, and it's going to not be the same. So your goal is to try to figure out, how do I put this together? And you work on that. You got 15 weeks to work on that. That's a long time. That's a whole semester for 6 conditions. Doable. Now, so once you've cut up these blocks, you work on it. If you're having difficulty, that's when you utilize your peers, your resources, your books, and you practice. You research it. You study it, because at the end of the semester, you are going to pick one out of a hat or whatever we have, and when you pick that one, you're going to have to demonstrate your concept map. And that's going to demonstrate your proficiency, whether or not you did the work. And this is a pass or fail. So study up, do what you need to do, use your resources. You have plenty of resources out there online, your books, and also your peers. As far as your instructor is concerned, this is a homework assignment. This is something that you're going to independently work on over time. And just keep on practicing. Why? These are the 6 conditions that you need to know. And that every nurse graduating nursing school knows these conditions and are able to teach their patients. And so it's a very practical and a high yield assignment. Well, that's about it. My name is Nursing Camp, and we'll see you on the next side.